Hi, I'm Karen Clark. As our company continues to monitor the spread of coronavirus or COVID-19, we want to make sure everyone is armed with the latest information. A health and safety response team has been assembled to consult with medical experts and recommend any changes to our company operations. We'll share updates and additional information as we get it. Make sure you check the First Energy Today portal, your company email, and our SharePoint pages. Again, those sites will also be updated as information is available. Here are a few things you should be aware of. An employee hotline is being set up to help answer any questions or concerns related to COVID-19. Information related to corporate policies, procedures, and answers to your frequently asked questions will soon be posted to the Corporate Health and Safety SharePoint site. HR has increased medical coverage so that any required screening for COVID-19 is covered. All business units are now encouraged to use Teams to hold meetings instead of in-person meetings. As a reminder, guidelines are in place for overseas travel. Anyone who has traveled to China, South Korea, Iran, Italy, Japan, or Hong Kong in the past 14 days, or who has a member of their household who has recently visited those regions, should contact the Corporate Health and Safety Group. Employees will be evaluated for return to work on a case-by-case basis. Joining me now is Dr. Tim Newman. He is our in-house physician. Thank you so much for joining us. We have a lot of questions, as I'm sure you know. The first question that I have for you is, can you tell us a little bit about this COVID-19? Some of the straight facts.
There are a lot of questions about the coronavirus, but it comes from a family of viruses that have originally come from China or the Middle East. And as you know, it's been transmitted from China to the United States. The coronavirus that is currently hitting the United States acts much like seasonal influenza. That means that people get sick, they get exposed, they get sick within about 5 to 7 days. Most people are getting mild or no symptoms.
If you could convey one very important point to employees, what would you say?
Well, there's a lot of recommendations that we call public health recommendations about washing your hands and covering your mouth when you cough and sneeze and keeping counters clean. Those are all important, but I'll tell you the most important thing is social distancing. That word is sort of odd, but it means trying to stay about 2 arm lengths away from people when you're talking. And the truth is that respirators or masks, like surgical masks, are used for people who are ill so they don't cough and spread illness, or healthcare workers. So those are the main points of prevention we should keep in mind.
Well, this is all very helpful information, and I know a lot of employees out there will really appreciate, again, just hearing those facts and obviously from a physician who's working very closely with it. Again, our company will continue to provide updates on the latest information on First Energy Today, SharePoint, and through company email as it becomes available. If you're a supervisor with employees who do not have access to email or a computer, please make sure to post all company information related to COVID-19. Thanks for watching. Stay safe and healthy.